Welcome to State of Reform's virtual series, 5 Slides We're Discussing, with some of healthcare's most thoughtful leaders. And now, the host of State of Reform, DJ Wilson.
Hello, and welcome back to another virtual conversation here at State of Reform. We're super excited to have you with us and excited to have really a stellar group of panelists who are going to talk with us and talk us through their thinking about how to manage our mental health and raising awareness of issues related to mental health as we hopefully emerge soon, one day, from this COVID pandemic. My name is DJ Wilson, one of the hosts here at State of Reform, helping to bring together these conversations, these sort of virtual communities where we can tee up some topics and try to wrestle them to the ground together. So without further ado, I want to introduce our panelists today. First, the inimitable Dr. Josh Green, Lieutenant Governor for the state of Hawaii, is joining us. Josh, thanks for being here.
Thank you.
Katie Akamoto, the Senior Vice President for Health Management at HMSA. Katie, thanks for making it. And Kumi McDonald, the Executive Director at NAMI Hawaii. I appreciate everyone making time to be with us. Let me ask you first, Lieutenant Governor, what are you spending your mental energy on these days? I know you got a lot on your plate, but what is commanding your attention?
I'd be lying if I didn't say COVID. There's a lot of COVID in my life, having had COVID and just trying to see our state and our 1.4 million wonderful citizens to the end of this thing. So a ton of COVID, but also the consequences of isolation for 15 months. I'm very focused on that. And I think that we're going to see some form of PTSD from COVID, and we shouldn't underestimate that and the impact of what it's been like to have changed our lives for this much time. It's going to take a little time to come out of it. So that's what I'm focused on.
You know, I think that PTSD thing is a real thing. We'll talk about that here in a little bit. Katie, how about at HMSA? Tell us about the work that you're working on, or the things that are commanding your attention today.
Yeah, so very consistent with what LG was talking about. I think our employees have been going through sort of a roller coaster through this COVID, and hopefully we're seeing the light at the end of the tunnel, but that is also still going to present changes for them that we're hoping to address and help them deal with in the future.
Are you, when do you all plan to start transitioning back into in-person, Katie?
Well, we have certain essential functions where we've had to still maintain staff in order to service our members. So we're still in what we're calling kind of the yellow zone and really planning for when herd immunity comes in or when we think that we can bring staff back. But I think in the future, things will be different, and we're trying to plan for that.
Yeah. And Kumi McDonald at NAMI, tell us about the work that you're engaged in these days.
I think a lot of families are finding first cases or first episodes of mental illness in their families. A lot of parents are calling us saying, my son's struggling with anxiety, daughter's had suicidal ideation. But also we're working on getting our police training back on track, which is Crisis Intervention Team, CIT, and a lot of partnerships are evolving because the pandemic has forced us to partner with other agencies to bring about some solutions.
Interesting. Tell me more about your partnership with the police services.
So Crisis Intervention Team is CIT, which is teaching police officers and law enforcement on de-escalation and mental health services. And so we partner with HPD. Last year when COVID hit, we did a statewide training for all law enforcement. So it was, the sheriffs and land and natural resources and, also HPD, MPD, all the different departments. And so we did that virtually. But this year we're going to go back into the training academy, and possibly by fall, we're going to be doing in-person 40-hour trainings again. And it's a partnership. It's not just NAMI. It's a partnership with Hawaii Health and Harm Reduction and, the mayor's office, clinicians and behavioral health specialists all come in to do the training.
Yeah. Well, great stuff. Keep at it. Keep at it. Lord knows we need all of the help with our police forces that they can get on that. I want to jump into our first slide here. This is one that we've brought to the mix. And before I do, I want to just say two, or I guess really just one primary thing to our audience. As you can see on the right there, there's a chat box. And of course, this is not rocket science, but go ahead and put your questions in the chat box as well. And you can hit the little thumb up icon and make sure that you prioritize those questions and comments. I'll integrate those into our conversation as best as I can during our discussion here today. This first slide is one that we have contributed. And as we think about the idea of raising awareness in general about mental health and solutions in Hawaii, this data point or this slide shows how we are in a number of instances across the United States have been deferring care, both mental and physical care. And in many cases, we're deferring multiple types of care, particularly for chronic conditions. So here you can see in the yellow or on the column on the right of each of these folks that delayed or did not get multiple types of care. It's as high as 43% for deferring both physical and mental health care. That's a lot, and 56%, over half of us, are deferring as a result of at least one condition. So, Kumi, let me ask you just your thoughts on seeing this slide. I know we have kind of collectively been talking about what deferred care might look like, but these strike me as really much higher numbers than I had otherwise anticipated.
I would say that for physical care, I mean, me personally, I'm taking care of my aging parents. I'm dealing with a teenager at home. I'm working full time, dealing with friends and family who have chronic mental health issues. I don't have time to take care of my physical health sometimes. So I've delayed going to get my annual, exams and things like that. But the mental health, I believe, is that a lot of people will call us asking, I want to get mental health care. I want to find a therapist, but there's a 3 to 6 month wait list. So I'm wondering that possibly people aren't utilizing services because they're not able to find a provider that will accept their either insurance, or maybe they're not able to see them right away. So I think and finance is another thing, because they're afraid of the copay. They can't pay for that. So I think that might be something that I'm noticing in our community.
Katie, I know in previous conversations with folks at HMSA, you guys have been eyes wide open on knowing that this kind of bow wave of demand may come back. What are your thoughts here? Are you seeing people return in significant numbers to access care, or is this still something that we're seeing as deferred into the future?
So we definitely saw deferral of care at the peak of COVID, but it's coming back. I think people are thoughtful about now how to deal with it, both from a physician and provider perspective, as well as patients. They understand all the protocols, they understand the scheduling, and I think we've seen an uptick, particularly in medical claims. But I think we're going to talk about that we still haven't seen the behavioral health, mental health activity increase as one might expect.
So you're still seeing that there's this kind of deferral that is ongoing. Yeah. Lieutenant Governor, as a physician yourself, but as a systems level thinker, how do you think this is going to play out? And I mean, if people are not coming back for care, is it because maybe that care isn't needed? Is that care going to show up in other ways with multiple chronic and co-occurring conditions? How do you think this plays out at the system level, maybe 6 to 12 months from now?
Well, it could look a lot like it did in Marvel, where we had the snap and everyone lost a year and a half. I mean, a lot of people just didn't go for stuff. I don't know if people know what I'm referencing, but I'm referencing how the universe kind of just stopped and half the people vanished, wouldn't go out, didn't do things. And I mean, look, I've personally used the pandemic as an excuse to not go see my dentist or get my colonoscopy. And that's a true story. I turned 50 during this whole thing. and Jamie's badgering me. But hopefully, knock wood, that year and 3 months didn't make a difference. But it will, for as far as the population health consideration goes, will make a difference. So we will see some upticks in cancers, and we will see some of the catastrophic moments. I shared, I think, a little bit, maybe not with this group, but Kumi will understand what I'm talking about on this one. My next door neighbor had some kind of psychological break, and he tried to murder a visitor of his, and it ended up being a big story in Hawaii. And it was our next door neighbor. Blood everywhere down our hallway, and she lived. He had some combination of a psychotic break and I think a drug overdose or something, and did this terrible thing. It was everywhere. There are examples of people having traumas. There are because of COVID. There are examples of people not getting health care because of COVID. My godmother went through chemotherapy, but she delayed it 5 months for ovarian cancer. It turned out to be an aggressive tumor, and she's an affluent New Yorker. So, it's everybody, and it could be anywhere. So I think that we're going to do some cleanup, and we're going to have to find ways to help people through it if they have a worse course or other comorbidities as a result of taking this 15 months off from healthcare.
And, as each of you have sort of spoken to, the sort of lack of supply when demand returns, the lack of access, particularly to mental health providers, is going to be an acute challenge. Do we need to start thinking about how we might provide mental health services in a different kind of scope of practice, maybe move down into non-traditional or maybe even very traditional community level engagement rather than in our traditional healthcare system? Kumi, you're nodding yes. What do you think about the implications of this in terms of our workforce?
So we get a lot of phone calls from people saying, I'm going through something, I need help now, but no one can see me. So then I tell them what we do, and we do provide support groups, we provide classes, resources, and then also shoot them off to, the Hawaii Cares line or even some online resources. There's a lot of things out there on the web that might provide something. Something is better than nothing. And then we also encourage people to find their own sense of community. But I think the support group was a really big deal for a lot of people during COVID because they felt like community, and we were able to provide that for them through NAMI programs.
How about you, Katie, as you think about changing the nature of the workforce or maybe supporting different kinds of workforce members? Certainly some of that happens already through your payment model in primary care, but how are you thinking specifically about supporting workforce changes in the mental health community?
Yeah, so we definitely are working with our primary care physicians, but also within HMSA, we've had a longstanding program of using licensed certified social workers to be out in the field, to use health risk assessments to determine if there are behavioral health needs. We work closely with Beacon Behavioral Health. When you see my slides, there'll be a number to call if they have issues with access or questions. And we've actually recently hired a group of community health workers who are able to even go further into the community and find people who might not normally reach out to us to see if they need help.
It's a good segue to jump into your slide here next up. So Katie, tell us what you have going on here in terms of your the trends and the work you've been doing on mental health.
So thanks, DJ. So very consistent with what you shared earlier, nationwide, we're seeing a trend of decreased visits and utilization. And locally with HMSA here, our utilization has actually been pretty flat. There's a number of reasons I think we can all speculate on as to what caused it. But because of COVID, many facilities that provide mental health, substance use disorder services had to reduce capacity because of social distancing, and some had to actually close if they weren't able to meet those requirements or had, instances of COVID. Though, the number of members using telehealth, I think on our slide in the upper left-hand corner, you can see that line just hit the ceiling in terms of telehealth services, there's still people who are not comfortable with virtual visits, and so we aren't able to reach everyone that we might. Though we increased by 3,000% in terms of utilization on telehealth, but still, we didn't have the normal increase in mental health services. In recent years, and we find this hopeful and promising, we've had about, on average, a 3% increase in the use of behavioral health services. We're hoping that means it's more accepting and less stigma around the services. But in 2020, compared to 2019, we had less than 0.5% increase. So, we think that that's not a good sign. I just wanted to share a couple of data points that we thought were interesting and might help the conversation in the future. But if you look at the bottom left-hand corner, we have our utilization by gender. So women traditionally have used services at a higher percent or higher rate than men. But this was increased during 2020. So women, were doing a better job. This does not bode well for men. The other thing that we have in the bottom right corner is some statistics. So it feels like the data is showing us that COVID exacerbated some of the already different services between men and women. So eating disorder diagnoses, already more frequent in women than men, increased by 48% in 2000 in our claims data. Conversely, for men, the diagnoses of alcohol, substance use, and lack of control decreased by 59%. So, that's a little troubling. People hypothesize it's because of, lack of social interaction, and this is kind of a hidden disease that hasn't led to treatment as appropriate. And then the last thing that I wanted to share in the upper right-hand corner was just a cut of our claims information by age. I'm sure when you see it, it won't be a surprise, but the largest decrease in behavioral health services was in the 81 to 90-year-old range. Definitely the group that we thought was at the highest risk, and they probably felt at highest risk. And then the other age group, we've moved it over to kind of align with the older age group, is in the 0 to 10 years of age, which we think is parents really protecting their children. Particularly in the early stages, you really didn't know exactly how COVID was going to impact them. And national statistics are showing that the diagnosis of ADHD in children is down 13%, which we really think is troubling, but may come from the lack of face-to-face encounters that children have normally had with teachers, coaches, and other adults who might point to treatment. So I think we've learned that we're at HMSA, we're all about the whole person. And, thank you for inviting us here to share this information, because clearly behavioral health is a big part of that whole person care.
Well, HMSA has been one of our best partners for years now, so we're honored to have you with us. 48% is a shocking number. 48% increase of eating disorders. I don't even know that I have a response to that. Kumi, are you seeing a variation in terms of people calling by gender? Are there a lot more women calling than men compared to 2019 or prior?
It's most of the time the call is from the woman. It's usually the mother, the grandmother. They're the ones who usually call us. So it's always been that way. I think that women are more intuitive, or maybe are the caregivers, so they try to look for services. Yeah.
Yeah, Josh, what do you see in this slide from Katie? There's a lot going on here.
I do. I mean, it's interesting because I think we stripped away a lot of our fixed beliefs about healthcare this last year, and I think they are laid bare with what Katie shows us. Some of the challenges people had. I mean, that 48% increase is crazy. I was with someone for dinner last night he told me the story of his daughter who's 18 and is at 70 pounds and is in crisis, and they're worried about her surviving because of an eating disorder. And she's due to go off to college in 2 months, and they don't know what to do. And it's hard. It's hard to find care because of the circumstance. And she's a teen and everything. But also, I mean, I was blown away by that 3,000% increase in telehealth. That tells us the system can actually change. And these, I have that part of that in one of my slides too, or piece of my slide. I just think that the crisis exposed us in certain ways and presents clear opportunities to continue to use. So as we go into the next phase where we open up, people can go back and see their doctor or their nurse practitioner, their PA, we should leave these other things in place. The things that were the access point challenges. That's what I see when I see her slide.
So Katie, you mentioned Beacon Health Options, one of the partners that you work with. They're a sponsor of some of our events. How does having somebody or an organization that really understands behavioral health, how does that help put you in a position to be successful? I just feel like there's like so much base level competency that the healthcare sector has to develop around mental health. This whole conversation is about raising awareness. That I'm wondering how you're in a better position to try to address some of these than otherwise because of that partnership.
So exactly, DJ. What we look to them is for expertise and their experience on a national basis, right? Many times in healthcare, and I think many times in business, information sort of travels across the country until it gets to Hawaii. I think, there's definitely technology has improved that, but we're hoping that, when we contract with Beacon and when we ask them to help us, it's their national experience, their national trends, and incorporating that with our information. Being sensitive to healthcare is still local. It's one of the reasons that they have staff, boots on the ground here in Hawaii to help us, to talk to providers, to talk to our members. So we're hoping that combination of national experience and a local investment will serve us, our members, the best that we possibly can.
So Laura Hawkins with America's Physician Groups asked this question, and Josh, I'll see if you have any thoughts on this. She asks, as the percentage of the population who has been vaccinated increases, do you think that this will elevate and maybe alleviate some of the stress and concern about mental health and that folks may have about reaching out for help? In other words, how will vaccinations impact this ongoing level of anxiety and stress, you think?
Well, if I may, I took care of a woman this weekend who had an injured ankle. That's it. Very nice young woman who she has been with her child who has a severe developmental disability for the last 15 months, and only her. And she carries a diagnosis of PTSD, and she was manifesting it, I can tell you, even though her injury was just nothing. It was just a high ankle sprain. But she did come out, and this is like the first time she had come out. She had to get a little care for this ankle, and she's ready now that we're vaccinated to go back into her behavioral health care. And it's going to be super necessary because she's been essentially untreated and not been able to see her therapist for over a year, which for her has been catastrophic. So we're going to have to open up. The behavioral health component is probably the largest component if I had to make a guess. I hate to be like this, but you can delay your dental care, or not ideal if you miss your pap smear, but we do that, and colonoscopies. I mean, that happens, but be fully isolated for 15 months when isolation is probably the worst thing for people with mental illness, man, it's going to be something. So we better be ready for that. My feeling is we should begin to move towards a place. I've said this on previous State of Reform conversations. I think we should begin to move to a place where behavioral health care is primary care, and make it easier than ever for people to characterize what they do and how they deliver care and authorizations and all that stuff. It's just so common. I mean, it overwhelmed other parts of the health system, bigger than cardiology, bigger than diabetes in my mind. So maybe that's where we got to get. And as we look to reshape healthcare, it's a daunting task because I know Katie and I are dear friends. I could see her thinking like, oh boy, here we go. For years we've been working on these things, but we have had to, balance resources and stuff. But now I think when we emerge, we better be ready to look at it that way.
Yeah. Quinn Ogawa asks about whether these slides will be available, and yes, they are. In fact, at the top of the chat box on the right there's a handout tab with probably a little red button there telling you there's something new for you to see. So you can go check those out and download those there. Lieutenant Governor, let's look at your slide here next up. Why don't you walk us through what you've got here for us?
So this is a slide. It's extraordinarily dense, but it's meant to just stimulate thought about what healthcare really is and what it's going to be going forward. I'm calling it social health, and that's in the blue box up towards the top. So what is social health? Social health is an integration of our traditional consideration for healthcare and the social determinants of health, of course, and the other larger questions that in society affect our health and our well-being. So I'm going to just do a quick blitz through this because I've got a couple minutes, right, DJ?
Take her away.
Think about it for a moment. Okay, for a long time in Hawaii, we've talked about the health disparities that exist for the Hawaiian community. They live about 10 years shorter. My wife is Hawaiian. Her mom died at age 42 of a gastric cancer. They live about 10 years shorter because of access to healthcare has been our traditional mantra. But it's more than that. I'm going to get into the more than that. And then there's the homeless consideration, which we've talked about together on a couple occasions, more than one. Homeless individuals in Hawaii live an average of 3 decades less than an individual who is fully sheltered and has a roof over their head. So instead of an average lifespan of 81 years, these guys live an average of 51 years, which is as bad as any lymphoma or cancer that you can come up with, basically, or heart disease or anything. 30 years is a lot of life to lose. And so if you look at what's gone on and how our health used to be perceived, long ago, it was you went to your family physician or the town doctor, and that was it. There were a few medicines out there, and you had a quick fix or a surgery, and that was all there was long ago. We've gone through a full evolution of access to so many specialties and different healthcare and analytics and imaging and so on. Yet healthcare now, in my mind, is driven, and people's actual social health is driven by, let's blitz into this orange box here, trauma. Okay, trauma is a great heartbreaking equalizer that can affect our lives, whether it's psychological trauma or physical trauma. Telemedicine, that is access to healthcare. And if you can access healthcare, if you have resources, if you have assets, and you actually are able to do it, you might get access to healthcare even if you're in a rural state or didn't have healthcare before. And how big is mental health? Well, as we all know, in this crisis and the crises that we've all faced, I've lost 2 of my relatives to suicide. One was 32 years old. One was 44 years old. Her uncle, my uncle also. It's just unbelievable that it took those 2 Ivy League educated people from us. And so they had great jobs and they succumbed to major depressive syndrome and bipolar syndrome and then took their lives. Then there's violence, as I described earlier. This is all toward the healthcare side and more traditional, and Medicaid, and how do we get access to healthcare? Do we have providers? Do we have insurance? But then as we go to the lower quadrant on the left-hand side, we also know that if people don't have assets and they don't have enough ability to cover their basic lifestyle, they don't live as long or they don't live as healthy a life. And so what is a living wage, I asked when I was putting this slide together. In Hawaii, the minimum wage is $10.10, which is $21,000 a year, which you can't, if you don't, couple with somebody or many people, you can't survive on that. Certainly can't take care of your children. We talk about going to $15. It's still only $30,000 a year, $60,000 for a couple. They might survive, but they will not have any access to better nutrition, which is why I have local ag there as we drift over to housing and food security as a part of health. Local ag, we do not have a sustainable ag culture here, but we do know that when people eat well, diabetes numbers go way down, blood pressure much better controlled, much longer lived lives, but that takes money. It takes money to do that, or choices. We could actually, turns out, produce a lot of our food in the state of Hawaii if we chose to eat more vegetables and certain other starches that we have. But you can't sustain full ranching and on the small amount of land that we have here, and everyone eats meat and sausage and stuff. So it's a challenge. We had other things on this slide as I got over to the far right, housing and food security. We found that one of the problems that we had with the pandemic was that those who were food insecure, if they had kids, they didn't have school lunches. And school lunches were the primary source of nutrition and therefore development for our young people. So that housing and food insecurity was devastating with the pandemic, but also affordable childcare. People might, they might think that that's not healthcare. It is, because if they can't get affordable childcare, they can't get a job. If they can't get a job, then they can't really afford to either be housed or have access to the medicines that we might ask. So all these things come together, and that's why I'm trying to over time develop this concept of social health, not just to describe. I wanted to start with today, starting to describe kind of this food salad and see the integrated pieces of it, and they each depend on one another: wages, access, and housing and food security. But over time, to look at those assertions that we've made, like zip code is more powerful than your genetic code. Looking at that kind of assertion, plugging in vulnerability scales based on trauma and violence across the country, plugging in the affordable nature of life. Look at all those things and getting a global social health score is where I'm hoping to take this. And I'm excited because I'm finding more and more people, and I'll stop here maybe, DJ, I'm finding more and more people that are interested in investing into different pieces of this as a part of the healthcare system. And if I may, COVID deconstructed a lot of the way we looked at things in the healthcare system, because we couldn't go see our healthcare provider for like 7 months. We couldn't get access to our behavioral health care, and we were self-medicating because that was necessary kind of for a lot of people because of the calamitous impact of a global pandemic. So all these things now, they're all fair game. I think they're fair game in the healthcare dialogue. And that's where I'm going to head when I talk about healthcare, I think, social health.
So Katie, a lot of this stuff is not covered by the traditional healthcare service financing mechanism. How do you see a company like HMSA leaning into a vision like this, or maybe not leaning in, maybe rejecting a vision like this, but in a way that might think through different kinds of funding mechanisms to be able to get at some of these things? Certainly, it's not an insurance plan's job to raise the minimum wage, so that's not all inclusive of plans. But how do you sort of stretch beyond what you do currently to meet some of or fill some of these gaps?
Yeah, so as the Lieutenant Governor was talking about social health and social determinants of health, that terminology has been around in the healthcare industry for a while, and we haven't solved for it. But at HMSA, we're trying to focus on what we call health-related social needs. We're not discounting the need for any of those things that are on the Lieutenant Governor's slide, but we think that we can be most effective in sort of a focused approach, which includes, food insecurity and all these social determinants that impact health. We're actually and the MedQuest department for the Quest integration plan is really focused, and I've been fortunate to oversee the service coordination area, which actually does get involved in approving generators for people's homes to make sure that their ventilators and their oxygen keeps working in case there's a power outage. Taking advantage of the federal program that gives people that qualify a mobile phone and maybe cell service for a year. Transportation when they don't have it, both from the neighbor islands and on Oahu to go and see their doctor. A lot of these things we've been really working on trying to stay within the financing bubble that we have to serve our members the best we can. But really looking to work with a number of organizations, Aloha United Way, Department of Health, Department of Human Services, Lieutenant Governor's Office, the city mayor, and and a lot of our corporate giving may be targeted towards more impactful services. Many on Lieutenant Governor's slide, but trying to get this focused and organized for us.
And TJ, I should interrupt her, and she doesn't take enough credit where she deserves it. I mean, Katie's been great, and HMSA did Blue Zones, which was very much focused on this comprehensively in the state, and funded our H4 project, which I should have snuck in this slide, which is the hygiene, healthcare, medical respite, permanent housing piece. I think they put up like $6 million over time to make that work, which hopefully saves a lot of money. We believe that's the case, but they were right in the thick of this. So hopefully people give them enough credit for it. It's really been special.
I was actually going to say, though, while health plans don't, sometimes people have mixed views on health plans for appropriate reasons. If every state had a plan that was like HMSA, I think America's healthcare system would be much better off. I think HMSA does great stuff. So, Kumi, let me ask you this question from Laura Ham, who asks, she says she loves the push for integrating mental health care with medical care. What do you think about integrating mental health and well-being in all of our school classrooms for the prevention and early intervention of more acute mental health challenges? That sort of integration fits kind of in this triangle that the Lieutenant Governor has put together. What do you think about mental health, deeper mental health integration in our schools?
Yeah, so it's one of the key principles of what NAMI stands for, is to get help early, especially to the youth, because we know that if the kids get treated early, the outcomes are so much better, even with serious mental illnesses. And like Lieutenant Governor said, that mental health is really the core of our well-being. If we don't have mental health, we don't have health, right? And so if someone is going through anxiety, they won't go and get a job. They won't go and make friends. They won't go and do the things they're supposed to, exercise, buy groceries even. So it really is a big component of what we do. And we go into schools, especially during the pandemic. We were invited to so many schools, middle schools, high schools, to educate their kids about early detection, how to get help. If you don't want to talk to your counselor, what other options are there? Because sometimes kids don't want to talk to their parents. So we give them a lot of resources like that. And we've seen a lot of success over the pandemic, reaching out to the youth.
Let's use that as a segue to jump to our next slide here. This is one that you've brought to the conversation, Kumi. A lot going on here with NAMI's name on it. Why don't you walk us through it?
So NAMI is about support, education, advocacy, and awareness. And we're grassroots nonprofit. And it started with parents of people with serious mental illnesses, gathering at kitchen tables across the nation, saying, how can we help our kids who are struggling with mental illness? Or how can we educate? How can we get more funding? And that's how it started. And so our key programs are about family support group, education classes, presentations. But since then, we've also moved into classrooms like Ending the Silence. And for people living in recovery from mental health issues, we have the Connection Recovery Support Groups, which has been instrumental. I could confidently say that we really, really helped a lot of people during the pandemic. So as soon as the pandemic hit, because NAMI Hawaii is a small organization, we're like, we're going to do Zoom. We're going to go for it. And we just went for it. And so we were one of the first in the nation where NAMI, there's like 600 affiliates across the United States, but we were one of the first to get it online, get the help that people needed in the community. And, the leaders are telling me sometimes the participants are crying and saying, I wouldn't have survived this month without NAMI. So I know that we're really a valued asset for people who are struggling, who can't get therapy right away maybe, but they can go to a support group. And so And then as the pandemic rolled out, we just saw more and more demand for services. We were the busiest ever. Like, it's kind of, the pandemic was a horrible time, but there was a silver lining in that mental health finally is getting the attention that is so needed. And we have been invited to so many webinars, workshops, classrooms, faith communities to just share resources and get information out there. So some of the projects that have evolved from that, again, I spoke earlier about the partnerships with crisis intervention team. We're also doing a partnership in preventing homelessness with Mental Health Kokua. We're also doing more and more education where we're training new leaders and teachers and support group facilitators, and the list goes on and on. But we're here for everyone. Anybody who wants to email us, call us, email us. We're here for you.
Great stuff. That's you guys got a lot going on.
Mm-hmm.
So, Katie, let me ask you this question from Mark Warfield, who asks about the economy's shift and the shift from commercial lives to MedQuest and Medicaid, and the impact on the behavioral health care delivery network. Have we seen at this sort of line of business level a fundamental change in benefits, in access, in provider engagement, as folks have moved, particularly from the hotel sector, from commercial to Medicaid? Have we seen a shift there?
So we've definitely seen a shift from our commercial line of business. So these are the private employers to our Quest line of business. And we have the highest membership that we've had in a really long time. I think it's challenging for those people, and we've really tried to help them with the transition. We've had the largest number of Quest members in the state, and I was talking to our board about how really proud I am of, I don't mean to sound condescending, but really proud I am of our provider community, because as they started to see these things happen, as their patients, went to them with anxiety about losing their coverage and what was going to happen, they were on the phone with us. They were talking to us about how they helped their patients, transition, how some of those providers who had not wanted to be in our network now were interested in signing up so they could continue to provide services to their patients. It was really impressive. But as you can expect, that is going to put a stress on not only the health plans, but the state to fund those and to continue to fund those. Unfortunately, I think we're seeing a lot of, even with the economic recovery, that many businesses have closed and may never come back, as well as economic right sizing, that they've found that they can survive with a different structure. So this is going to continue to put pressure on our economy and our members.
Yeah. Well, let's jump to this last slide. We're starting to get a little bit short on time, and I want to flag this for us all within the context of trying to raise awareness about mental health issues. This slide demonstrates essentially just the shift from pre-COVID in terms of average number of Americans who have self-attested to challenges with anxiety or depressive disorder symptoms, and how that compares to January of 2021. You can see the share of adults is now, according to this, at 40%, 41% of respondents saying that they are struggling with anxiety and depressive disorder symptoms. So, Josh, when we started talking, you talked about this sort of PTSD, this sort of like long, like hangover of COVID. Tell us why you think that there is this sort of PTSD related to COVID, and how you see us navigating through that as a community.
Sure. First, let me say that if we're 40% of any health issue, it's primary care, period. It's primary care now. So, I think that case has been made. So we'll work it out, and I think care has always been something that when we invest in well and we do a good job with it, it pays dividends for society and health and cost and everything. We know that if we're too heavy on specialty care, it's a challenge. If we're good with primary care access, which is why Hawaii has often been number one in healthcare outcomes, a lot of primary care, we do well. So I wanted to put that out there. How do we know that we have PTSD? You just see the skittishness in people's eyes. They're actually having to reboot a little bit. And I've seen a lot of there's been frantic behavior, of course. Everybody I know has lost somebody during the pandemic, not necessarily from COVID, but a dear friend of ours, a radio disc jockey here, number one in the state. He lost his mom a couple weeks ago, and it was traumatizing for him because he hadn't seen her much at all for these months, and then she passed, and so that leaves a psychological mark on our souls when we have that happen to us. There are so many consequences that are like that. So we're gonna have to just face the facts that these traumatic events, which historically we could deal with normally, we didn't get to deal with normally this time. So I hope that we're just ready for that. I mean, I think there will be a deluge of need for care, treatment, therapy, describe it how you will. That's that piece. I do have some worries about the impacts of addiction and how that causes trauma. It can be tough. One of the two people I mentioned that we lost in my life, it went from bipolar disease to self-medication to then physical trauma. And so, and this cousin of mine, she had already had very terrible PTSD as a result of relationships that had been dangerous. So when I see these things, it just is evident. And I would say there's some other telltale signs. I can't say that I can address these analytically, but there seems to be an uptick of restlessness in the nation. In Hawaii, we've seen a fair amount of additional violence that's occurred, and in turn, some individuals being shot during the course of, policing the events. We've had a large uptick in violence in society because I certainly don't blame police or anyone. I just am observing. And all of this is trauma. It's trauma on society. When we lost 2 police officers here right before the pandemic, it caused statewide trauma because it was so, it was such a huge emotional and psychological blow to a small state. I was amazed. And then we had COVID, and it was even larger. So I just think there's all these signs out there. And I won't be surprised, actually, if there aren't individuals that become trauma specialists as a result of COVID. Long COVID is being discussed. And I think there's even the physical trauma on the brain and encephalopathy from this virus, which one of our other dear friends, Dr. Zunin, he shared a lot of stories about how his, I think it was his mother, she had COVID, I believe, and then never really came out of it. You know how sometimes an insult hits the system, the body, and if someone's elderly, it leaves a trauma and they don't quite get restored to their baseline and normal. That's there too. So all these things are there for us, but that's why we're healthcare providers, right? That's why we're into health policy, because we're not just going to look at what was going on in 1987. In 1985 to 87, we had HIV/AIDS, which we had never had before. In 2001, we had a global trauma from 9/11, which we never thought we'd have, and that created all kinds of problems in New York physically and otherwise. And then in 2019, 20, 21, we had COVID. So I guess what I'm saying is this next generation will hopefully be mentored by us, and they'll get into this public health problem.
I want to end these conversations on a happier note than sometimes the content with which we engage would otherwise suggest. So to do that, I want to just ask each of you about what gives you hope in healthcare these days as we sit here in May of 2021 and as you look ahead. Kumi, how about you? What gives you hope and inspires you to do the work that you're doing?
When families say that NAMI has really helped them and saved their lives, that really keeps me going, because we know that families who've experienced it are helping other families. And that's what we're all about, giving back.
That's great. Katie, what gives you hope and inspiration to do the work you do?
At HMSA, I think we've seen our employees as a microcosm of the community really pull together and pitch in and do anything that they can, learn new skills, help our members, reach out to them for, even if it's not our member, throughout the community to help, to volunteer any way that they possibly can to contribute to the health and well-being of this state. And I've been really proud to be a part of that.
Lieutenant Governor, what gives you hope and inspiration to do the work you're doing in healthcare?
I'm going to take a couple pages out of what Katie just said in her book, but Kumi also. People stepped up for behavioral health coordination when people were isolated, and we provided shelter if they had COVID, and whether it was the Heroes program or programs for people who just were sick and needed to be apart from their family so they didn't spread it. All of those questions that we try to wrap a bow around about what can we do to get people well and keep them safe. There was collaboration galore. The big health plans, health providers rather, came out and they're vaccinating people. HMSA stepped up and said, yeah, no problem. We're not going to make it difficult, make it as simple as possible. Don't worry about the administrative stuff. Don't worry about anything. Just get vaccinations into people. It's good for us all. And to a person, people who maybe hadn't worked together in years or didn't overlap, everyone just chipped in and really helped. I mean, it was really quite extraordinary, which I guess is what you dream of seeing when you're going to have a pandemic or a global, an existential threat, which is what we were facing. So that's really promising, and that may very well be what we come out with. That's probably the silver lining after going through this pandemic. So that was really wonderful to see, and I'm personally hopeful that one of my kids or both go into healthcare after seeing all this.
That is a hopeful statement. People that will send our kids in healthcare. I don't hear that.
My daughter went back to school and she's pre-med because of COVID.
Wow.
Yeah.
Fabulous. Awesome.
Dr. Josh Green, the Lieutenant Governor of the state of Hawaii, Katie Akimoto, the Senior Vice President for Health Services at HMSA, Health Management at HMSA, and Kumi McDonald, the Executive Director at NAMI Hawaii. Thank you guys for doing this. And to you all in our audience, we appreciate it. We'll have this recorded and posted online at stateofreform.com. And thanks again for letting us play this role in Hawaii healthcare. We are super honored that you allow us to do this. So we'll keep doing it as long as you keep reading our stuff. Thanks, everyone.